I think the really important thing about developmental screening, any kind of screening, is it's don't ask, don't tell didn't work for the military, it doesn't work for families, it doesn't work for children. If you don't ask a parent what their concerns are, my experience is that most parents won't tell you what they're actually thinking because they're kind of waiting for someone to give them the green light that it's okay to talk about their concern, because you got to remember, from a psychological perspective, these parents are scared shitless, excuse my language, but they are terrified that something may be wrong. And no one's telling them that anything's wrong. So that's kind of like, okay, maybe nothing's really wrong, maybe I'm being a worry wart. So I don't say what's really wrong, but everyone around, we all learned back in high school, don't tell people what you really think. If it's a problem, if they're your friend, because they get mad at you because it's kill the messenger. So this is a lesson that we learned very early on, not to tell people what we're really thinking for social continuity. And then the payoff is that kids don't get screened early. So if you don't ask them, they don't tell you. I can't remember how many times I've asked, quite often the mother, oh, when did you first have your concerns? And they say, man, very early on I was worried. Something seemed off with this child. I just didn't understand. But everyone kept on telling me either everything was fine or that I assumed everything was fine because nobody told me anything was wrong. And then about 24, 36 months, all of a sudden someone said, you know, I think you really need to get your child worked up. But they were worried before the 12-month checkup. So again, don't ask, don't tell, it does not work. What are regional centers? If you don't know, we're private nonprofit corporations. We have a contract with the California Department of Developmental Disabilities. And we provide state-mandated services and supports for persons with developmental disabilities, age 3 and over, as well as infants and toddlers at risk for developmental disabilities. So we serve all kinds. We have 2 different programs, basically the 0 to 3, which is early start, or the California Early Intervention Services Act and the California Prevention Act, and we are the operative agency which implements that in the state of California. You go to other states, they have different ways of doing it. And we also, this is part of the federal 0 to 3 legislation.
It's a pleasure to attend this 3rd annual developmental screening conference that is sponsored in part by First 5 Ventura County. I'm a practicing pediatrician in Thousand Oaks, member of AAP, local and national. And in our practice, we've been doing developmental screening for a number of years. We were using Denver developmental testing until the first conference that I attended, when the comment was made, Denver developmental, is that still alive? Should have been killed off years ago, at which point we switched to peds. I'm also a First 5 Ventura County commissioner. I was completely unaware of First 5 and what it does until somehow I got appointed to become a commissioner. But I quickly learned how much good it actually does. For those of you who are unfamiliar with First 5, Dr. Condell mentioned some of the services that are provided. It's a great resource. Ventura County First 5 is one of 58 locally based commissions across the state. It's funded by the tobacco tax money for the benefit of children 0 to 5. We got our mission statement changed from 0 to 5 to prenatal to 5, acknowledging the importance of the prenatal period also. This money is currently at risk while our governor tries to balance the state budget. I have to stay politically correct, but feel free to boo the attempt to abscond with our funds. The programs we fund are too good to lose. Knowing the critical importance of the early years in terms of lifelong social, emotional, and cognitive development, First 5 invests more than $1 million annually on a network of essential services for young children and their families, including community-based health, early learning, and family strengthening services, anchored by 11 locally designed Neighborhoods for Learning, or NFL. We've heard earlier today how poor our developmental screening rates are. First 5 is trying to help with that. Developmental screening with the goal of connecting children with needed early intervention services is a key strategy. First 5 promotes these efforts, these screening in both the community, medical and community settings. First 5 funds the Landon Pediatric Foundation to promote and provide training for pediatric healthcare providers in the use of surveillance and screening at appropriate intervals using the validated tools. First 5 also funds Ventura County public health nurses and health educators to offer ongoing screening and related parent support in the community plus home visits for at-risk families. Families can access these services by calling 211 or through their local neighborhood for learning. Parents need an understanding of normative development. The quality of conversations about development that they have with their children's healthcare providers is critical. And I encourage you to look at the Born Learning materials for pediatricians' offices. These have simple, easily understood guidance for parents in Spanish and English, and there's also a Born Learning website with additional resources. These materials are available to local physicians free of charge.
All right, this is really what I wanted to show. I wanted to kind of highlight a child who has gone through early intervention. Dr. Condell should recognize this child. He's actually one of his patients and has been for a long time. And he's a kiddo that I started working with as a behavior therapist when he was only 2.5 years old. So this is the point. This is why we are like pushing developmental screening. This is why you're all sitting here taking time out from your Saturday morning to talk about it. It's kids like him who I know when he came in who was completely nonverbal would not have done as well if he had not been identified through screening and if he had not received early intervention services through Early Start First and now through Tri-Counties Regional Center. So first I'm going to show you a quick video clip of a baseline clip of him interacting with mom. So the child and mom came into the UCSB Kegel Autism Center for screening, and we asked mom and child to interact for about 10 minutes using the toys that are available. And the video will highlight some of the things, but you'll notice is he's playing really nicely, but no interaction and engagement with mom. This is limited babbling. So he's the kind of kid that actually would get missed if you didn't do screening because he does play very nicely. Doesn't have a lot of externalizing behaviors. So looks pretty good. But actually, I believe it was Dr. Condell who referred mom, having seen him at the office, to the center for more comprehensive screening. And then quickly, I wanted to show you a clip of him a few years later. And even though his language still isn't perfect, it's so much better than where it was from not speaking at all. And just notice how much more interactive he is.
Yes, I am 7.
Okay, turn. I like to talk to Lisa. I was in right here.
Okay. The rest of you have a 2?
Let me check. Nope, go fish. Oh, my turn. Okay. Jack, do you have an 8? Oh, yeah. Oh, thank you. Okay. Okay. Okay, Tyson. Tyson, do you have a 2?
Let me see. Yes, I do have a 2.
Oh, thank you.
So he's in regular elementary school. He's doing relatively well. He's got friends. So again, this is the point. This is what we want to see as getting kids into programs to help them accomplish these things. And so that's pretty much all I wanted to say. There's our information. If you need more, if you have questions, and actually I'm going to bring up the other slide. This has our website too. So this is the website. I will put up some of the handouts and PowerPoints and all that good stuff, but I will send you an email with the links as well.